This is one of those cases where you have to be in the Dr. Alex mentality from day one, meaning you can't say, you know, I see where you're going, doc, but I'm gonna make a decision at the end whether we're gonna do the whole thing or not. This is kind of from the beginning, you're on board and you're ready to go on this journey with me, because my mind is going 2 phases. First, we're gonna do Invisalign. After we straighten everything, we create the ideal spaces, proportions, then we throw on the porcelain. So what am I seeing from the beginning? Obviously, a ton of crowding on the bottom. Here's what's not obvious. This is actually a canine. We're missing a lateral incisor. That means the tooth next to the front teeth is missing on one side, and on the other side, it's actually a peg lateral. So if you saw some of my other stuff, we finalized the case where one patient had a peg lateral on one side and a missing tooth on the other. This now is essentially that same exact concept, but now we got to go a little bit further. And we have a gap in the middle. So this is the right side. There's an actual tooth that is missing right here. So we have to bring this tooth all the way back. But aside from bringing this tooth all the way back, we're also going to be moving and widening the smile in the back on the right side. So we're bringing this tooth all the way back. We're also changing the inclination of those front teeth. So if you're able to see, the angle of these front teeth are inverted. So by doing Invisalign, we're not only creating space, we're also uprighting the teeth. So from this angle, you could see that even better, that all of these teeth are pointed sort of in a backwards direction. That means the front teeth are retroclined. And this little peg lateral is also angled in this direction. So what do we want to really do? I'm going to go to this next photo when you're going to see this is the exposure of all of the teeth. Obviously, these teeth are all very high. We call that super eruption, and they're all misaligned. So we're actually going to be bringing all of these down, and we're going to realign these teeth. That's the bottom. On the top, we're bringing this back. We're bringing this so that it has gaps here, ideally, so we don't have to reshape the tooth very minimally. Since the size of this tooth is smaller than the size of this tooth, I'm going to raise this tooth a little bit so that the gums have become equal. So what you're going to see at the end of Invisalign is that this tooth is actually going to be shorter than this tooth, because what we're going to do is we're going to, and I'll show you next, here is where we are. So this tooth is now all the way back where it needs to be. Now we have a gap here for a tooth to be received, but we have to think about how are we going to attach this tooth. Is it going to be from the back, which you know about a Maryland bridge, or are we going to do something called a veneer bridge? Veneer bridge, yeah, a veneer bridge, I'll show you. And as I mentioned earlier, that's the difference in the front 2 teeth. So what's beautiful about this, since I know I'm doing a veneer on this front tooth, I actually don't have to reduce the edge of this tooth at all. We don't have to prep that part of the tooth at all. So being able to think about the orthodontic aspect, Invisalign, and the restorative aspect, I essentially think about all of these concepts together to create the best outcome for my patients and the least invasive approach as well. So as we continue on over here, you see I created that gap. I maintain that intentionally, knowing that a veneer is going to slip over on the front and the back. I don't need to cut much of the tooth at all. So here's this veneer bridge I'm talking about. This tooth is going to act as a abutment or an anchor for that missing tooth to the side of it. But if we go back, we could also see that it's missing some tissue. In order to make it look natural, we have to kind of fill in that tissue gap over here, which is what this pink porcelain is right there. And we're using that to kind of camouflage and create proper proportions of these teeth. So, and then obviously on the adjacent teeth, this is a veneer and this is a veneer as well. So we are working on, this is that veneer bridge that I was talking about. You don't need to shave the entire tooth anymore. You can use modern day techniques and adhesive dentistry to have a really great predictable outcome. Here's where we finished. Yeah, I know. Everything's aligned and everything is straight. Everything is aligned and everything looks straight. That's the bridge over here, the veneer bridge, and then that's the veneer bridge over here, and these are individual porcelain veneers. So if we look at it from this side, remember I was talking about all of the teeth were inverted, they were retroclined, they were all backwards. Now look at that position right there, straight up and down. This is a veneer that didn't need to be reshaped at all for the tooth underneath. And you can see now how that arch form is absolutely beautiful going from one side to the next. And when you have the teeth, you're showing it. Now these teeth are all straight. This is where we want it to be. And if you need a reminder, that's where we started. And that is where we have a happy patient.